thank you and welcome, and thanks for joining us, Jack. So we've asked you to talk about your experience with sudden sensorineural hearing loss. And the advantage of talking to yourself is not only are you an audiologist that sees it from the consultant's point of view, you're also someone that's experienced it yourself, and you were happy to share your results with us today.
Yeah.
So
Absolutely.
Thank you very much. So let's go back to August 2022. So when did you first notice that you had a change in your hearing?
Well, ironically, it was during an appointment, and what was happening was I was explaining hearing aids to someone I was seeing at the time, and I was going over futures, and the next thing I know, I would turn my head, then out of nowhere, my right ear just dropped with hearing. Couldn't hear, well, very little compared to what I was used to. At the time, I thought it was very funny. I've had issues with my ears all my life, and I thought it was just a bit of tinnitus, and it would have gone away and come back up again. But no, I went on for another 10 minutes, then 20 minutes, and then half an hour passed, and I thought, well, this isn't normal. So luckily, I had a colleague at the time through in the other consultation room, and they gave me a hearing test there and then, because I explained what was going on. And yeah, my hearing had changed dramatically in my right ear. Next thing I knew, I was driving on my way to A&E, trying not to worry anyone. But when I got there, after explaining what was going on, a doctor saw me, and I got some steroid tablets. And then for the next couple of days, it got slightly better. And funnily, I was watching Come Down With Me, and then my hearing came back in my right ear.
All right. So how long after it was it that it reverted back to your normal levels?
It was about 3 days or so.
Right. And did you feel that it was pretty much back to the normal levels at that point?
I'd say if I had to put a percentage on it, about 80, 90%. It didn't feel fully back, but it was a lot better than what it was. And then the things I remember most about it was I was waking up in the span of those 3 days. It wasn't better. I'd wake up and hope, it would just pop or something would come back, and it never did. And then, as I say, it just randomly popped. And then I could feel the sound getting gradually louder. I knew something positive was happening. And then, yeah, it's gone a lot better.
Yeah. And how do you feel it is now? Do you feel it's back to normal again?
I would say it's back to normal. I don't do myself any favors, if I'm being honest. I'm well into my music, and I go to a lot of concerts. And since that incident, I have been wearing a lot more hearing protection. I should have been doing that more beforehand, but you're young and naive. But yeah, it's gotten to pretty much normal to what it was before, I'd say.
Mm-hmm. Fabulous. And when your hearing changed, did you experience any changes to the tinnitus at all?
From what I remember, I don't remember my tinnitus being any louder or changing in nature or sound or anything like that. I think it was just the same.
Yeah. And had you had any other concerns beforehand? Had you been poorly or anything like that?
I think one thing that could have done with it, I remember that summer being very busy. I was doing lots of activities, different things. I was also busy with work. I wouldn't say it was down to stress necessarily, nothing like that. I think it was just my body was run down a bit tired. And then that could have been something that targeted, because I've had issues with my ears basically my whole life. I was born, I had glue ear, I had grommets, all these sorts of things. So I think it was just something my body was going to attack, and it attacked that.
Yeah. And you shared your audiograms with us, and we'll pop those up onto the screen for everyone to see. So we're looking at here where you had that change in that hearing level. So that's the audiogram that your colleague took for you, literally in the moment. And most customers wouldn't have that opportunity to have the audiogram done so quickly. So you can see that there is quite a significant asymmetry between the two ears at that point. When you took the audiogram results, did they look at those at the hospital for you?
It was a bit of a funny story. I took them with me, and and then I explained what I did. And I did explain that for what I do, I'm not medically trained. But obviously, Dr. Google was there in the waiting room and I was seeing what I could do. And the doctor asked me, "Oh, well, what do you think we should do then?" And I obviously said steroids. That was just seemed the through line of everything I was looking up. I don't know what sort of steroid it was at the time. I had a little fear for a second. I thought were going to break my eardrum and do some injections, but of course it
Yes.
was no horror movie things. It was just a tablet at the end, thankfully. What was the other bit of your question? Sorry, Sarah.
I was just wondering, had the doctors actually looked at the audiogram?
I think they gave it a passing glance.
I mean, in reality, you only need to quickly glance at it to see there is that significant difference.
That's true.
And your medical history would have said, well, normally they're quite balanced.
Yeah.
And then all of a sudden it has changed there. And I know the referable criteria has, or the referable documentation is updated since that happened in 2022, but it was the same situation then. If you had that sudden change, it used to only be within 7 days, and now obviously it's been extended to within 30 days for the that you've got to see A&E immediately, ideally within the 24-hour period. Yeah. So apart from experiencing it as an audiologist and as a patient yourself, or as a hearing aid dispenser and a patient yourself, have you had any experience with customers at all?
Off the top of my head, there was only one time where it sounded very similar to myself, in the sense that they said they had issues as a child. They also were into music and things. It was quite a mirror image. And they said that I can't remember what year specifically it was, but one of their years had dropped. And I said, you need to go to A&E now and get it sorted out. Unfortunately, I can't tell you how that went because I'd never got in touch with that person again. They didn't come back to us, but I'm sure they would have gone to A&E straight afterwards.
Yeah, that's fair enough. And was that before or after your experience?
That was after, because I was thinking, oh, this sounds a bit scary. So yeah, advise them to give them a referral and send them to A&E.
Yeah. And did you share your experience with the customer at the time?
I went into a little bit of detail. I didn't want to scare them. I didn't want to give, put my own experience onto them too much. But I did say I've had something similar in the past and it's best to get it sorted out ASAP.
Yeah, fabulous. And so just moving forwards in terms of supporting other colleagues and other audiologists within the field, what would you say are your top tips to advise the customer when something like this does happen?
I would say there's a big sense of urgency to do something as quickly as possible about it. The longer you wait, or the longer you wait to do something about it, even, say, I'll wait for a GP appointment, absolutely not. Go to A&E, get it seen to as quickly as possible, because there's such a small time window where I think I was very lucky in the sense that, of course, I worked in Boots. I had someone to see me very quickly, tell me what was going on, and then straight to A&E. 99.9% of people don't have that luxury as I did. So no. I advise anyone who's experienced something like I did, straight to A&E, say what's happened to your dog there, and then, or whoever sees you at the hospital, and explain that it is urgent.
Yeah, right. Well, thank you ever so much for sharing that with us, Jack. And it's been a pleasure catching up with you today.
No bother at all. I've enjoyed it.
Thank you.
I've just included there a comparison chart of the two audiograms together so we can see the differences. So again, a huge thank you to Jack for sharing his experience with us, in particular sharing those audiogram results. If you would like to learn more about sudden sensorineural hearing loss or about any of our other topics, including cochlear implants, please look at the other videos available on the BSHAA YouTube channel. Thank you.